Good afternoon, guys. I have discussion A for you. We're discussing what to expect in home care and hospice settings. Okay, so give me a minute to set up for the show, please, and I'll be right with you to start. Okay, the article discusses what to expect in home care and hospice settings, emphasizing the emotional challenges families face when entrusting a loved one to unfamiliar caregivers. It highlights the importance of understanding care environments to ensure peace of mind and trust in professionals. The piece also touches on the stress involved in caring for terminally ill patients and elderly individuals, reinforcing the need for compassionate and skilled caregiving. If you're interested in specifics like caregiver qualifications or patient autonomy in these settings, I can delve deeper. Caregiver qualifications vary depending on the type of care provided, but generally they include formal training, certifications, and practical experience. In home care and hospice settings, caregivers may need, basic training. Okay. Give me 1 second, please. Many home health aides and personal assistants complete state approved programs covering safety, hygiene, and patient interaction. Certifications. Depending on the state, caregivers might need certifications like certified nursing assistant or CNA or home health aide HHA, specialized skills. For hospice care, training in pain management, emotional support, and end of life care is crucial. Experience and background checks. Many agencies require prior experience and conduct background checks to ensure reliability. Okay, soft skills, compassion, patience, and effective communication are essential for building trust with patients and families. Since you're deeply interested in patient autonomy and self-directed care models, are you also exploring how caregiver Qualifications impact individualized care choices. Promoting patient autonomy requires caregivers to possess a combination of technical expertise, ethical awareness, and communication skills are the key qualifications. Number 1, training in person-centered care, understanding self-directed care models, informed consent, and shared decision making empowers patients to remain active participants in their own care. Competency and medical ethics. Knowledge of autonomy related ethical principles ensures that caregivers prioritize patient preferences while balancing safety concerns. Effective communication skills. Caregivers must be trained in motivational interviewing and active listening to help patients articulate their needs and make informed choices. Cultural competency and sensitivity, recognizing how personal, cultural, and socioeconomic factors impact decision making, allows caregivers to provide more inclusive and respectful supports. Flexibility and adaptability. A rigid one size fits all approach doesn't work in autonomy focused care. Caregivers need skills in individualized planning and responsiveness to changing patients' needs. Knowledge of legal and advocacy frameworks, understanding patients' rights, surrogate decision making, and advanced directives helps ensure that autonomy is upheld even when patients face cognitive decline or complex care solutions or situations. Since you're deeply invested in self-directed services, are you exploring ways to improve how caregivers are trained in autonomy driven approaches? Effective training methods for person-centered care focus on empathy, communication, and adaptability. Here are some of the best approaches. Experiential learning. Caregivers participate in role-playing exercises that simulate real-life patient interactions, helping them understand different perspectives. 2, case-based decisions. Using patient cases studies Caregivers analyze scenarios involving autonomy, informed consent, and decision making challenges. 3. Active listening workshops. Training in motivational interviewing and reflective listening helps caregivers respect patient preferences and encourage self directed choices. 4. Cultural competency training. Learning how to navigate diverse beliefs. Traditions and languages ensures that care is truly individualized. 5. Ethics and advocacy models. Courses on patient rights, dignity, and self-directed care models reinforce autonomy centered decision making. Simulation labs. AI based virtual reality hands on situations allow caregivers to practice responding to complex patient needs in a controlled setting. Mentorship and peer coaching. Pairing new caregivers with experienced ones or mentors fosters skill development and real-time learning. Since you're deeply engaged in self-directed services, are you exploring ways to hold on, refine training programs for caregivers to better support individualized care models? Okay. Several recent studies highlight effective training methods for person-centered care. A 2023 systematic review examined how older adults, caregivers, and healthcare providers experience person-centered care. It found that formal training in shared decision making and autonomy improves care quality. A 2021 study analyzed continuing education interventions for nurses in long-term care. It emphasized the need for learner-centered approaches, moving beyond lectures to interactive methods like case-based decisions and simulations. Okay, give me 1 second, guys. A 2022 evaluation of caregiver-centered education programs showed that competency-based training significantly boosts healthcare providers' confidence in integrating family caregivers into person-centered care. These findings reinforce the importance of experiential experiential learning ethics, training, and communication workshops in caregiver education. Since you are deeply engaged in self-directed care services, are you exploring ways to refine training programs to better support autonomy-driven care? Certainly. In 2023, systematic review examined how older adults, healthcare providers, and caregivers experience person-centered care, or PCC, in community settings. It synthesized research evidence to identify barriers and facilitators in implementing PCC. Key findings: capacities. Many healthcare providers lacked formal training in shared decision making and person centered knowledge, limiting their ability to support autonomy. Opportunities: strengthening multidisciplinary teamwork and improving resource allocation were, were identified as crucial for effective PCC. Motivation: engaging self reflection, or self reflection, respecting patients' autonomy, and establishing reward mechanisms were essential for sustaining PCC practices. The study emphasized that education and training for caregivers should focus on enhancing person centered skills while fostering a supportive environment for older adults. If you're exploring ways to refine caregiving training for self directed services, this research offers valuable insights. You can read the full study at msn.com, guys.